just checked it.
I think I was 13 years old when they told me that I had a heart murmur, but I was too young and I didn't really knew about it and I just ignored it.
But I started feeling the symptoms.
The palpitation started when I was like 18, 19,
Blacking out a lot. I get lightheaded. I would get shortness of breath. And I found out about my sickness. They told me that I have mitral valve prolapse, and I didn't know what was it all about.
Well, the mitral valve is one of the 4 valves in the heart that help to control the direction of blood flow through the cardiovascular system. And the mitral valve can become diseased in a number of ways. It can become very stenotic, very tight, and restrict the flow of blood through the heart, or it can become floppy and regurgitant and allow blood to go backwards.
With my everyday lifestyle, especially with singing too, yeah, it was really hard for me. Like I couldn't last a song. I really ran out of breath. People would like tell me, Mia, watch it, your heart. They would always tell me that, and I'm like, and I forget, and then until I feel it, like, oh yeah, my heart. Oh, there was this one time that I actually passed out while singing and dancing.
In Mia's case, for example, she had significant mitral regurgitation from a degenerative valve. That particular disease process can be treated with an operation called mitral valve repair. We're able to do these operations with much smaller incisions so that you can't see the incision in a typical shirt. This approach also prevents us from having to split the sternum, the breastbone, and so you don't have to heal thick bone. The other nice thing about doing a mitral valve repair in a young person is that it prevents them from needing to have a valve replacement, often a mechanical heart valve. It's even more important in young women because if you get a mechanical heart valve and you have to take the warfarin anticoagulation, that blood thinner actually can cause birth defects. The need for anticoagulation of any sort will make a pregnancy more challenging.
My surgery was done and they told me that we actually got your heart fixed. You didn't get prosthetic valve or mechanical valve, we got it fixed. And I was really shocked because in that way I can have my baby already. I just can't explain the feeling. Knowing that my heart is really in good condition, I can have it anytime, then we're just really excited about it.